knowledge without application leads to no action. And so for me, when have seen just like a really been only with the company 3.5 years, but have gone from basically where you start to regional sales leader is really, I think, is because of taking action on that education and on that self-improvement.
Hello and welcome to another episode of Your Business, Your Next Level. I'm your host, Eunicia Peret, and today I have Ryan Bell joining me in the studio. Ryan is a medical sales strategist and performance coach. He's known for helping physicians and clinics scale cash-based wellness programs through hormone optimization and integrative medicine. As a regional leader with Evexias Health Solutions, he partners with OBGYNs, family medicine, and pain specialists to expand patient outcomes and practice revenue using evidence-based protocols. So if you're a physician, listen up because you'll learn something from Ryan. If you're on the receiving care side, listen up because Ryan is going to be sharing some unbelievable things that will be applicable to you. And with that, Ryan, welcome to the show.
Yeah, thanks for having me. Excited to get this podcast started.
Absolutely. Well, let's dive right in. Tell me a little bit about what drew you to the world of integrative medicine, hormone therapy, and very importantly, this is something that we don't see a lot of, is integrative medicine coupled with some of the specialties that I introduced you with as part of the introduction. How does that work and how can we get the word out there more? But first, tell us more about you and how did you end up in this space?
Yeah, so grew up playing sports, I've always had like a really love for health, fitness, wellness, and that carried kind of over into my military career. So I was in the Army for 8 years, in charge of our fitness program overseas and here locally for 6 of those years, and then ended up getting a degree in kinesiology, exercise science, and nutrition, and started doing personal training, corporate wellness. So I did that for about 13 years in Kansas. And my family and I, we ended up moving out to Arizona about 4.5 years ago. Was looking into, what potentially else is out there in the health and wellness field. Do I want to stay in personal training? Do I want to open up my own facility? And just was kind of seeing what the landscape was. And this position that I came across with Evexias Health Solutions, working with medical providers, still for me, what I liked about the personal training is hearing those, client success stories and the impact. Very first day after I graduated, my kind of goal was to how I can reach 1 million people. I don't know why. Then that was my kind of like, how can I reach 1 million people is kind of like my why. And so I did, personal training. I'm like, oh man, to get 1 million, this is going to take forever. So then I started doing group training and then that transitioned into corporate wellness. And then now into this role, now our company, helps roughly around 60 plus thousand patients per month just with the therapy that we provide. And so then I'm like, okay, now I know that reach is possible. And finding out, that the company still, like I said, still I get to hear the client success stories from my practitioners. Every week I get texts about emails, social media messages about patients saying it saved their relationship, it saved their marriage, it's helped improve their job. All these different kind of fun things that I still get to hear about in regards to kind of like how I got started with Evexias.
I love it. And for the company, you cornered three major states. I understand it's Arizona, Nevada, and as well as Hawaii. Really cool there, right? How are you able to make the biggest impact specifically in the medical community, Ryan? Especially since you're approaching everything through more of an integrative wealth approach, especially when it comes to dealing with doctors, with physicians that perhaps they're more traditional in the way that they approach health in general.
Yeah, so that's always, the challenge is once you kind of get trained one way, you kind of have a set mindset of that's the way it kind of should always be. So my approach really, with the markets and then also overseeing, Washington and Oregon as well
Oh,
now.
beautiful.
So
Congratulations.
thank you. But really just, having a conversation with them, just asking, what their patients are experiencing. Are they experiencing some of the different, side effects and symptoms from hormonal problems? And then asking them to not necessarily, make a sweeping change of their thought process, but just be willing to take a little baby step backwards and just be like open to just hearing some information, hearing some of the research, some of the newer studies and observational studies as well too. Like the patients are the advocates themselves, and more we see that patients are the ones that are kind of determining what they want to do. They're having friends and family that are getting on some of these more quote integrative therapies and having a lot of success with it and wanting to see like, okay, well, my friend, my spouse, my coworker, what are you doing different? You come in, you're vibrant, you're not getting sick, you've lost weight, and all these kind of positive experiences. And so really over the last couple of years, especially this last year, even more so, it's really just being patient driven, where doctors I called on several years ago that had like zero interest in, and now are calling me back, asking like, hey, are you still the hormone peptide guy? We're interested in setting up a new meeting, essentially, saying they're having patients just start flooding their offices, asking about this kind of therapy and asking, kind of more root cause medicine.
Absolutely. Wow. Well, first of all, before we go too far and I forget, thank you for your service. And based on how young you look, you must have been 5 when you started, right? We'll just leave it at that.
Yeah, we'll leave it at that.
We'll leave it at that. I love it. One of the things, Ryan, that you said is that's very, very important because we see this on the financial side as well, is patients are their own advocates. And oftentimes, here's what we're seeing on the finance side, particularly in what we do at Excelstra. Clients will come in and they'll fall in one of two camps. I see the team. They'll say, I see my team, and they're not doing the things that I would like for them to do. They're not proactive. They want more. And then there's the camp of individuals who will say, I've been with my team for a long time. I trust them implicitly. They're not proactive, but they are very conservative, and I'm okay with that. And either one of them are fighting for what it is that they feel they're doing to better represent themselves as part of the situation. What are you seeing on the health side? Because it's very much the same with the patient when they're going and they're asking a physician who perhaps is more entrenched in the traditional, right? That's kind of in our world, the parallel is the typical financial advisor, CPAs, the yada, yada, yada. Or they're going to the physician who is already aware of some of the more integrative approaches and are able to have those conversations. What are you seeing there with clients, and how can we help clients/patients in the medical world feel like they really truly need to own the relationship and the discussion with the doctor, with the physician, especially in situations where perhaps their physician has not really embraced the more integrative approaches?
And that's the thing is patients, are more and more, not accepting the fact that, what the doc says is the ultimate go-to. It used to be kind of like whatever the previous generation was kind of like whatever the doc says, that's like the law. And now patients are going in and, wanting to feel heard. That's one of the biggest complaints, and why patients leave practices now isn't because of like the lack of medical care. It's because of lack of feeling heard by their practice and being dismissed essentially, especially we see this more so in women than in men. A study I just read not too long ago showed that about 65% of women often feel feeling of dismissal from their practitioner, and especially like an OBGYN, essentially because a lot of times OBGYNs are taught all of the hormones, but they're not necessarily taught the actual management of hormone optimization and kind of what that can, benefit the patient on. And so many times that woman leaves, being told that, like, oh, that's just part of aging. That's just part of, going part of, your menopausal transition or being in perimenopause. Here's an antidepressant for your mood swings, and I'll see you in a year. Well, fast forward a year, though that patient didn't have, antidepressant, they were low on antidepressant genes and are low on those. And so fast forward, and typically we see, that same patient now is presenting with even more symptoms the following year. And same thing, they bring these symptoms up. And a lot of it comes down to not that the doctor doesn't want to help them. It's oftentimes, like I said, I speak to thousands of doctors, and every single one of them tells me that they just simply weren't trained on how to really appropriately manage those patients. So they're doing the best that they can with the knowledge that they have. So that's definitely something, very clear that we know doctors get into the business to help patients and to help people. They're people of typically servitude, but they also too, a lot of times don't know the business side of things and how that can affect the business. I find that very often. And I'm guessing you probably have kind of come across that as well too, is like, they're so entrenched on wanting to help the patients, sometimes their business suffers because of that. And so when we go in, we try to help them kind of marry the two together, like, hey, let's listen to your patient so you keep that continuity of care with that patient and they don't go elsewhere for the therapy. On the back end, by you doing that and providing optimal patient care and outcomes, now you actually get kind of the money on the back end and get to keep that recurring revenue from that patient coming in and the referrals and a happy patient, gives as well.
We see that all the time, Ryan. Actually, we work with a lot of physicians. We sponsor a lot of physician conferences as well. And one of the things that we see often, again, from a financial lens, because that's where Excelstra plays, is the physicians are so entrenched, you're right, in the patient care and all the things that they're being thrown at from a regulatory perspective, and the reimbursement rates going down and lower. It feels like every single year. Many of them do not think, they don't have the ability, not the capacity, they don't have the bandwidth and the time to really think about scaling back, right? Taking a step back to think about how do we re-energize the practice and how the practice can be structured in such a way where it's not about getting more necessarily from the client, is repositioning the way that they're thinking about their business, so that instead of, we've had surgeons who said in private conversations, they've said, Eunicia, we don't know, a husband and wife, for example, owning a surgery practice, the husband said, I don't know that will be around in 10 years time. And so what we do know about the physicians that are surrounding themselves, this is key, they're surrounding themselves with the type of experts that can actually, maybe put them in the right rooms or surround them with the right type of expertise, then they're able to take their business to the next level and feel less of the financial pressure. Specifically on the finance side, one of the things that we're seeing is physicians are leaving way too much money on the table. For example, they're paying too much in taxes. They're not thinking, like, they're going through this rigmarole, right? They're paying taxes, they're paying their dues every single year. What if we could shift the paradigm? They could pay less, because guess what? They can, by the tax code, and take that money, reinvest it into the business. Going back to what you said earlier, change the business model. And now all of a sudden, you've made a couple of very strategic shifts, and ultimately you're set up for success, versus the question of, will they still be around in 10 years?
Absolutely. And, that comes down to also by being able to work, not always in the business, but actually being able to have that time to work on the business. Also, too, helps to really eliminate one of the top reasons a lot of physicians get out of practice or sell their practice: burnout. Physician burnout, especially with the insurance model that we see year over year over year, either stay stagnant and or insurance reimbursements are, slightly decreased. That physician, just to keep the lights on, has to see more patients, not to grow their business, just to break even now. And we're seeing, more and more that are having to potentially get bought out to these large hospital groups, because of they're not, like I said, have the time to work on the business to be able to grow these different potential avenues of income streams, and to know, like I said, from a financial perspective, what are they missing out on? Not just from a therapy's perspective, but from a perspective of, investing and being able to, in saving and tax preparation. All of those play a huge benefit. To your point, I've talked the same thing, kind of these private conversations where they're like, Ryan, we're kind of living paycheck to paycheck here. We're trying to keep everybody housed and employed. You can just feel the weight of the world on their shoulders. And, and so my goal is come in as a consultant and kind of like, well, let's break that down. What are we currently doing? What's working really well? Where's a lot of your money coming from? What are different things we could potentially reduce and reinvest that into something that might bring you more money on a per appointment basis? And going forward, how can that also too help relieve stress, to have you have a better family life, and because, if you're not also having that, then the weight of the work just seems to stack on top of each other.
100%. And you mentioned something that's huge that we see. You're right. A lot of physicians looking to leave practice. That should be concerning and alarming, not just to physicians, but also to the public at large, because with fewer physicians, the stress on those physicians continues to increase, and the burnout is even more real. It feels like from a year to another. You talked about the buyouts. Buyouts are and have been a big issue as part of the M&A, that mergers and acquisition activity that's happening across the medical realm, that's even in dentistry. Now we're seeing it on the optometry side as well. What ends up happening is oftentimes physicians, and I love the fact that you mentioned the team, right? They don't have the right team on their side. And listen, when I say the right team, I'm not talking about your iBanker or your business broker told you to have a financial advisor, CPA, an attorney, and whomever else on your team. I'm not talking about that team, because here's what's happening. And Ryan, you've probably seen this. When you're talking to those individuals, everybody's all about what is it that they're doing for you. But at the same time, how is it that they're getting compensated? A key thing that we're seeing, I don't care if it's Excelstra, find a company that can actually support you. If you're a physician contemplating what by being bought out may look like, Find a company that can, or a team that can actually watch your back in a way that is not tied to someone's financial success. The reason that is key is because when we talk to these other guys on the side of the transaction, here's the reality of what happens. Oftentimes, especially when we talk to companies that are on the buying side, they will tell us flat out, we don't care what happens with the bottom line of the person that's selling or the group that's selling, because the reality is their job is to transact. Now, that doesn't make them bad people. They do what they've been trained to do. But just like you said, Ryan, the physicians haven't been trained to be thinking about the business side of things. It's important to make sure that you're watching your bottom line. How much are you paying in taxes? How are you structuring that practice? If you do want to go through a sale and exit strategy, how do you structure in such a way that where you can actually talk about strategy sale, not just dollars and cents? And of course, coming right back to our conversation here with Ryan, you might not even need to sell if you can think outside of the box and think additional income streams, which, by the way, that's what you love to do. If you're a physician, that's why you went into medicine, because you want to help clients, you want to help patients, you want to see them better. What if we were to change the paradigm?
Yeah, absolutely. And, with that, a big thing, we see is like knowing your numbers. So we have like monthly trainings down in Texas, typically anywhere between 400 to 700 people, about 10 times a year that come down, that we train doctors all across the country on hormone therapy and integrative solutions, different integrative solutions. And recently we just had a refresher training here up in Scottsdale with the docs that have all been with us, that have already come through kind of our initial training. And we had this really powerful business implementation specific section. And that was what almost all of them that signed up for our refresher training was like, yeah, we like the medical too, but we're here for the business implementation. Like, how can we grow our business? And so we're, just kind of going through these different exercises of knowing their numbers, asking, different things that they're doing, not doing, different things in marketing that they're doing, not doing, reaching out to patients from a perspective like, do your patients even know all of what you even offer? Because many times we see they don't. They come in, everyone kind of has they're on their phone, they kind of have their horse blinders on, they come in for exactly what they're there for. And then if you're not, continually educating your patients and reaching out to them so they do know what, the entirety of what your clinic may offer. Once again, like, as you said, that's just a missed opportunity with that patient, like I said, that is probably getting a number of those services elsewhere that had they known or had they been educated that one clinic offered it. We're simple creatures. We want simplicity, like, versus having like piecemeal a bunch of stuff together. If we know we can get like streamline that and not have to drive to all these different places, and we already know, like, and trust where we're going for our primary care, the likelihood of them wanting to stay on for these other services exponentially goes up. And then therefore that, patients' ROI obviously goes up as well too, because now they're referring their friends and family because they are keeping everything in-house. And then that makes that practice more profitable, able to reach their community better, able to serve more people, able to have better outcomes.
Absolutely. I mean, what you said is huge, Ryan, in terms of streamline your services, right? Don't piecemeal them. We see that happening in the financial world, where oftentimes individuals want to work with a team that will streamline everything, and they end up choosing the wrong teams because what they're thinking is everything is under one house and you're just going to go in and you're going to get it done. Whereas a lot of the physicians, what we know, when they streamline their services and they cross collaborate even with other physicians, it's different. It doesn't have to all be right under the same roof. It's truly about being strategic with ultimately the services that they're offering. I'd love that you went there. Now, Ryan, one of the things that I know you love to talk about is how your health is very directly tied to your wealth. Clearly, I love talking about the wealth side. What I'd love to hear is, what have you seen in your working with physicians out there in terms of how is their health or even the patient's health directly tied to wealth?
Well, one of the things, is first impressions, mean a lot. You have 3 seconds before and somebody's creating a first impression on what you look like. And they've done countless studies showing that the more healthy and fit a person looks, the higher perceived that they are in job interviews, the higher perceived they are as like their wealth status, the higher perceived that they are as like a likability for dating and relationships. That just being one initial aspect, but also two, when you are, the healthier you are too, the less sick time you're having to expend, the more time you get to have with your family, the better you show up for your job and your work, the better your employers see that you're going to, or assume that you're going to show up for your job and work. Because to stay healthy, it is a discipline. There's a discipline that's involved in exercising and eating well and sleeping well and managing stress and having your financials in order. That's all discipline that, all comes down to creating a healthier you. And when you can create that healthier you and, you have a positive mindset, that is going to directly translate into how you interact with your coworkers, how you interact with your spouse, how you interact with your kids, how you interact with your leadership team. And so when we see that all kind of intermixed together, we see, people's income kind of directly rises, a direct reflection of that.
I can absolutely vouch for that. And one of the things that you said is being healthier. Also, it translates. I want to just pause here for a second. It also translates into much stronger, much higher business success, because there's also everything that you said, right? The mindset is there. They feel better. They're able to make the better decisions. There's also more discipline. And what I've seen also an ability to think more clearly. In other words, without fear, right? Oftentimes when physicians, business owners, entrepreneurs, it's not just limited to physicians, it's any successful entrepreneur out there. They have this fear of, but if I move, if I make this shift, will they be okay? Whether it's in their practice, whether it's enhancing the teams that they work with, whether it's letting somebody shift around on the bus, or maybe bringing somebody else on their business bus, financial bus, health bus, whatever bus we're talking about, is when they're healthier, they're able to actually think with a lot more clarity, and that fear subsides. And when the fear subsides and they take the action, they make that step forward. That automatically translates into more wealth. It translates into a better resonance with everything that they're doing. And all of that goes right back to they feel better. So it's a never ending loop. I feel like it's a beautiful feedback loop that goes on and on.
Yeah, exactly. And, like when to be healthy, like I said, it takes discipline, but it also takes overcoming challenges. The more challenges that you overcome and put yourself through difficult times in getting healthy, the more challenging when you have challenging things that come up in the workplace and your job, meetings, presentations. Those seem much less stressful when you've already are used to overcoming, daily challenges. So every day, trying to do something that's challenging in the first, if you can do it first thing in the morning, even better, because first thing in the morning, you do something challenging, and then the whole rest of the day, you've already overcome something. And so things that as they come throughout the day just become that much easier to kind of like brush off your shoulder. You're able to think clear, make better decisions. Typically healthy people also sleep better, and if you're not having adequate sleep, that's another big thing that's going to cause increased stressors. The more stressed you are, the higher cortisol response, and the less apt you are to make, good decisions as well in that regard also.
Cortisol response, inflammatory response. I mean, the list goes on and on and on. Oh my gosh, we could talk about this all day. Ryan, one of the questions that this has been amazing, by the way, and I know that a lot of physicians will be listening to this. I know also that a lot of individuals that are probably working with a physician or multiple physicians on your health. Just know that, listen, the struggle is real. Just like you as an entrepreneur have challenges and things that you're working through, they do the same. And sometimes I feel like physicians have it even harder in today's day and age. So Ryan, the fact that you're out there and you provide so much support to those physicians, it's truly beautiful. One of the questions that I absolutely love to ask on our calls is, when you're thinking back in your past, what is perhaps one of the biggest regrets or failures, perceived failures perhaps, that on the other side has taught you something meaningful? And what was that?
I think was the biggest thing was not taking the action I knew I probably should take. So over the last, I'd say 2 years, I've gotten really, really big into self-improvement, and finding ways to do that, but then not just listen to things and listen to the self-improvement, but to actually apply it. I think that's the biggest thing that I regret not doing much earlier on, is when I, even when I was doing personal training, I had these kind of grand ideas to like do different things. When I was in corporate wellness, kind of same thing, these kind of grand ideas to do different things. I listen to podcasts, I read all the books and gather all this knowledge. And then it's just like, I just keep gathering the knowledge. And then it's like, without, knowledge without application leads to no action. And so for me, when have seen just like a really been only with the company 3.5 years, but have gone from basically where you start to regional sales leader, is really, I think, is because of taking action on that education and on that self-improvement, and then knowing kind of like what your why is. Like I said too, not tying it to a big enough why is another massive reason I think why people don't hit what they want to hit success-wise, is they don't have a big enough why.
I love that you mentioned that. And one of the things, an example that comes to mind, Ryan, speaking of the why, a couple of years ago, we were speaking with a husband and wife, highly compensated physicians, and they came to us through a referral. And because the husband didn't know their why, didn't want to step into it, you said knowledge without application is just, I filled in the word noise on my end because we see that a lot. 2 years later, because the husband didn't have the why, because they weren't able to take a step back and really think about what's happening in our case, in this particular case with their finances. 2 years later, again, a highly compensated husband and wife, powerful duo, they're leaving hundreds of thousands of dollars on the table. Meanwhile, they're asking the question of how can we do better, but they're absolutely refusing to say, how can I get the help that I need? Where do I get the help that I need? And when the help shows up, they boomerang right back, because that noise that's in their life, because they don't have the proper support, they don't have the coaches, they don't have the mindset and the tenacity to go forward, keeps them stuck. And that stuck costs a lot of money. So as I'm hoping that our listeners are not stuck, maybe they're the lucky very few, that top 0.01% that have actually made it through. And if they're not, then guess what? There's a lot of help that is available right here in the show and in this episode. Ryan, as we part today, are there any parting thoughts that are sitting heavy on your heart based on what you're seeing out there in the physician community, or perhaps something that was generated out of our discussion today?
Yeah, I think the biggest one, is just be open. Like the best decisions you can make is to make it as an educated decision. And so that's what I see is that the doctors that, like I said, are willing to make a decision based upon getting new education for one, but then also two, for patients, and just the general public is, be open to learning, be open to feel like you're seen and heard. Your symptoms, symptoms matter, and you will find a doctor. That there are plenty of them out there that are, trained and that have advanced training. And then I think lastly, is like when you mentioned the power to change, sometimes that power to change has to be greater than the power to stay the same, where you really got to want to know what the difference is. And sometimes it's painting the picture of like, change is hard. We all know that. Humans are innately designed to not change and to kind of have that safety net. But, being able to describe what not changing looks like on the opposite end of the spectrum really can help you kind of see like, what am I missing out on? And one of the things that brings me kind of to my final point is when I was at personal training, I got to work at several different elderly old folks retirement homes and do these like kind of chair exercises with them. And afterwards, it's always great getting to hear all of their stories. Of course, they have a new young person in there, so all they want to do is talk to you. And the biggest thing, talking to all of them that they regret it wasn't the things they did, it was the things they didn't do that they wish they would have done.
Oh my gosh, that is so, so powerful. I'm going to start with the last one as you're listening to this episode. It doesn't matter what area of life, what area of life you're dealing with, whether it's on the health side, whether it's with family, whether it's finance, what that area is. Do not let time pass by, because the things that you need to make a decision. If you don't make that decision, you will probably learn to live with that regret. So let's not do that. And then Ryan, you also said beautifully, make an educated decision and also make sure that you feel seen and heard. We know that there are situations in life where people feel unseen. They're not being seen. They're not being heard. They're just being fed ideas and solutions that perhaps were always there. The question you should ask yourself is, what's new and how does that relate to you? And when you're able to do that, just like Ryan said, it's beautiful, because then your eyes are open to new possibilities and you can step into those with boldness and with tenacity. And with that, I thank you for being here on the show. Ryan, thank you for being with us. And until next time, stay tuned for your next episode of Your Business, Your Next Level.
Thank you for joining us on Your Business, Your Next Level podcast, where it is all about helping you make more, keep more, and elevating your business to the next level. To learn more, make sure you head over to www.podcast.excelstra.com and don't forget to subscribe, rate, and review the show. Again, that's podcast.excelstra.com. Until next time, thanks for listening.